Okay, Dr. Najib, if you are ready, please start.
Hello,
Hello, doctor.
I'm Dr. Najim Mohidin, one of the doctors working in this hospital today. Can I please check your name, please?
Yes, doctor, this is Miss Fatima.
Are you the daughter of Miss Aisha Noreen, 50 years of age?
Correct, doctor.
So, we are here to talk about your mother's condition. Is that okay?
Sure, doctor.
Before we start, can you please let me know how much you know about your mother's condition so far?
Yes, doctor. My mother actually, she was admitted to the hospital with infection in her waterwork. So they did investigations, including a jelly scan to her tummy. So they said her kidneys are not working properly, doctor. And because it has got some sacs on it. So they started down treatment for the infection. And doctor, actually, they said everyone in the family might be affected. So I am really worried, doctor. So do you think I have it? Do you think I have this disease?
Ms. Fatima, it seems that you're very, very concerned about the condition that you have. I'm here to help
Yeah,
you
indeed.
in every step of the way. Okay?
Yes, please, doctor.
Okay, so you seem to be very much aware of your mother's condition. So, and you're very concerned about the condition that you may get it or not, right?
Exactly.
Okay, so let me, I'm going to get to this point shortly. So let me just explain to you, how what the disease actually is. Would that be okay?
Yes, sure, doctor.
So the condition is called polycystic kidney disease. Okay?
Okay.
Sorry about the medical term. So it is a condition which you rightly say there are fluid-filled sacs in the kidney. So this fluid-filled sacs ultimately causes damages to the function of the kidney. It cannot work properly. Are you getting?
Yes, doctor.
And there's a possibility that in the future that the kidney will not properly work because of the fluid-filled sacs. Maybe I can help you by drawing it. Would that be okay?
Yeah, please, doctor. You can draw.
So, so this is the kidney, suppose. Sorry about my and the fluid sacs over here, multiple fluid sacs. Okay, and this is what's causing the damages to the kidney and cannot working properly.
Okay.
So
is it serious, doctor?
It is a kind of serious condition because this condition can cause total kidney damage.
Oh, goodness, doctor.
So I'm very sorry to give this news to you. Okay. Are you okay?
Yes, doctor. Continue, please.
So one of your concern was that whether you have it or not. I'm very sorry to say that there's 50% chance that you may have this condition.
Oh my God, doctor, this is really bad. So what do you suggest, doctor? Do you think that I should go for screening, maybe?
Well, since you are, it is good that you go for screening because there's a possibility that you may have it, and for that we can do some jelly scan of your tummy to see whether you have this cyst or not, which we call the polycystic fluid sacs. Are you getting?
Okay, so this jelly scan will identify whether I do have the disease or not.
Yes, it will. It will. There's a if there is cyst on the kidneys, this jelly scan will identify that. Yes.
Okay, doctor.
Okay. Any other concerns that you have?
Yeah, doctor. Let us assume that I was found to have this disease. So, what options of treatment do you have? Do you think I will need dialysis?
Well, we will going to, if you do have this fluid-filled sacs on the kidneys, we're going to form a multidisciplinary team with the kidney doctor and a specialist nurse, and we're going to further do some investigations to see your kidney function. It's not like that we will immediately need dialysis. There are medications available. We need to go. Are getting me till now?
Yes, doctor.
So there are medications available. We can give some medications, and we need to control your blood pressure because there's a possibility that it may be high. And hopefully, sometimes after the age, not all patients go to kidney damages. Not all patients need dialysis. Some patients, however, may not need dialysis even in the later stage of life. It's very unpredictable.
Okay, doctor. So what should happen regarding my siblings, doctor? Do you think they need to go for screening also?
So can you tell me the ages of your siblings?
Yes, my brother is 20 and my sister is 18 years old.
Okay, since they are of age, what we can do is we can talk to them, and if they wish to go for such screening, then we can also do a jelly scan. We can also do that for them. I can refer you to a genetic counselor, and for that matter. How does that sound?
Yeah, it sounds good to some extent, doctor. However, I'm concerned, doctor. Do you think that I really need to go for the screening now? Because I do not have any problem. I do not feel that I have any symptoms like any tummy pain. So do you really think that it is necessary that I should go for the screening now?
Well, Fatima, the thing is that there is a certain medication available and certain things that we can do to stop the progression of kidney damage if we detect that you have the cysts in your kidney. Are you getting it? So this medication, and if you control your blood pressure, then hopefully the kidney damage will be very slower, and we can continuously be on. We can continuously be on regular follow-up.
I see. I see. So, doctor, do you think my future kids will get the disease?
I'm very sorry to say, Ms. Fatima, there's still a 50% chance that your kids may have.
Oh my God, doctor. This is really bad.
I'm very sorry to give you this news, Fatima. I hope. Are you okay? Do you need a glass of water?
Yeah, I'm fine, doctor.
Anything you want to ask me?
Nothing comes to my mind now, doctor.
So can I tell you a bit more about what about the things that's about the measures that we will be taking for your mother and what can be done?
Yeah, please, doctor.
So we have already formed a multidisciplinary team with the kidney doctor, and what we are going to do is we're going to control her blood. We're going to control her blood pressure and give some medications. So in the future, I would advise you and tell her and advise her to not to take any medications or painkillers without consulting the doctor. Okay, and avoid any kind of contact sports. That's very important.
Okay. You think that I need to avoid what, doctor? Contact sports?
Any kind of contact sports because it may cause some ruptures of the fetal sac.
Okay, doctor.
There are certain complications that happen with this condition. Can I tell you that?
Yeah, please.
So as one of them, they already mentioned that the kidneys will be damaged. There's possibly the kidney may get damaged. Also, there may be chance of recurrent infection of the waterworks, and also there may be chance that the cyst itself may burst, and there may be some bleeding within the cyst as well. But please be assured that we have a very good team, and if anything happens, we're going to take care of your mother.
Okay, doctor.
Okay. Anything else you want to tell me?
No, doctor. I think you have answered all my questions.
So what we are going to do is, I'm going to give you some leaflets, brochures, and website addresses regarding this condition, and I will give you a number of our departments. You can contact us at any time. Okay.
Okay, doctor.
And I will refer your family members, you and your family members, to genetic counselor for further things you need to ask regarding this screening process. Okay.
Okay, time up.
Thank you, sir.
Okay, doctor. Okay, doctor. Thank you. Okay. Someone is speaking about very aneurysms and so on. We will come to this point in a minute. For now, Dr. Naguib, if you allow me to comment about your performance. What you have done is very nice. Okay, your structure of the consultation was perfect. You're starting by the introduction, and then your closure was okay, and then in between the body was acceptable. Although I have very minor comments, which might or might not affect your score in the exam. However, I will compare your performance to the actual performance of the candidate who did this scenario in the exam. He did exactly the same mistakes you have done in this scenario. Okay. So your introduction was perfect. You did introduce yourself to the patient. You did confirm his identity. I mean, the surrogate. Okay. However, when you are not speaking to the patient, if you want to speak about the patient health status, you need to highlight the issue of confidentiality. At least ask one or two questions. Are you her next of kin, or is your mother happy to you to discuss her health condition with me? Okay, just to give the examiner the idea that you are aware of patient confidentiality. Because why? Because in the exam, there will be no examiner's question. No one is going to ask you which ethical and legal issues are surrounding this scenario. Okay, so you need to highlight them in front of the examiner. When you start, after introducing yourself, you will confirm her identity. And then here you will add a question. For example, are you her next of kin? Is your mother happy for you to discuss her health issues with me? If you do it this way, the examiner will understand that you are aware of patient confidentiality, and he will give you your score within clinical judgment. Okay, this is the first comment. And then
can I do like this? I have already taken permission from your mother to talk about your condition. Can I do like this?
Sometimes even they will mention to you in the scenario from outside. Whenever necessary, please assume that her mother gave you the permission to speak to her. However, if it is not mentioned, you need to highlight the issue of confidentiality. It's up to you how you will do this. However, this is an example. You can ask her whether she is the next of kin, or you can ask her whether her mother is happy for you to speak to me, or you can say, I assume that your mother gave you the permission to speak to me about her health. Many ways, however, try to highlight the issue of confidentiality. Express your knowledge about ethics and law in front of the examiner. Did you get the point?
Yes.
So within skill F, which is managing patient concern, in order for you to get the full mark within skill F, which is managing patient concern, you need to first seek patient concern. Have you got any questions? Did you understood this point? Have you got any concerns? Have you got any particular worries? I will prompt the patient to raise concerns. Okay. If she raised a concern, I will appreciate that concern, and I will address the concern with sympathy, For the candidate who did the scenario in the exam, both examiner 1 and examiner 2, both of them commented blank communication, lacked sympathy. This is very important. This is the most common examiner comment on the candidate performance, lack of sympathy. So try to be very careful on this. And it is not only about the content of your speech, like, I am sorry. If you say, I am sorry that you have got this disease, but your tone of voice does not reflect that you are really sorry. Here, again, they will comment that you lack sympathy. Okay, the content of your speech should reflect that you are sympathizing with your patient. And the tone of your voice, it has to reflect that you are sympathizing with your patient. Is this point clear? It is very important. It is not only about the content of speech, but sometimes even about the tone of your voice. Okay, so she raised a concern here. Doctor, do you think my future kids will get the disease? You said, I appreciate your concern. Yes, I am really sorry to tell you that they will have 50% chance of getting the disease. You said 50% because it is autosomal dominant, right? However, for this particular person, we don't know the status. We don't know whether she have polycystic kidney disease or not. For her, the percent is 50%. However, for her kids, because we don't know her status, it is 25%. It is 25%. So the correct way to address her concern, I appreciate your concern. For now, we don't know your status. We need to conduct the screening for you to confirm your status. However, if you test positive, I'm sorry to tell you that they will have 50% chance of getting the disease. Okay, so take care. And then within skill E, which is clinical judgment. Clinical judgment is about the plan. The plan of management has to be sensible, and also about your knowledge about ethics and law. Whenever it's appropriate, try to take the chance and highlight your knowledge about ethics and law. For example, you are in the exam, because no one is going to ask you, by the way. Before, in the previous format, the examiner will ask you what ethical and legal issues surrounding this particular scenario, and then you will explain yourself during discussion with the examiner. However, according to the new format, there will be no discussion. You need to take the chance to highlight your knowledge in front of the examiner for them to give you the full mark within skill E. So let us assume I am discussing with a patient his diagnosis, and the diagnosis is IBS. And clearly it was mentioned from our side that all investigations, including the camera test, are completely normal. The consultant is 100% sure that the diagnosis is IBS. This scenario is very common, by the way. So when I entered inside, the surrogate was asking to do a camera test. Please, doctor, do a camera test to be 100% sure that I do not have cancer. Here, immediately, I will take the chance to highlight important ethical principle. Do you know which one of them you need to highlight here? Whenever the surrogate is asking for unnecessary investigations, unnecessary treatment, any treatment or investigation which is not indicated, which ethical principle you need to highlight in front of the examiner?
Non-maleficent.
Non-maleficent.
Excellent, exactly. So here immediately I will take the chance and I will highlight the issue of non-maleficence. Okay, I assure you all investigations are within normal. Camera test was already done and it is normal. Okay, our consultant is 100% sure about the diagnosis. Conducting more investigation will be more of risk than benefit. In our practice, we do not do unnecessary investigation unless the benefit outweighs the risk. In your case, already we reach a clear diagnosis. The camera test has got its own risk and it will add nothing. I will try to highlight my knowledge about ethics in front of the examiner. If you look to the examiner, you will find that the examiner is ticking in your paper. He is giving you the full mark within skill E because you demonstrated good knowledge about ethics and law, particularly the ethical principle of non-maleficence. Okay, otherwise, if you do not do it, you will not get the full mark within skill E because you will not have the chance to express your ideas for the examiner. So within skill E here, it's very important that you discuss the plan of management, and your plan of management has to be sensible. Okay, for example, you need to highlight the benefit of the screening. What benefit the patient will get from the screening? What are the disadvantages for this screening also? Okay, because this is patient autonomy, right? Patient autonomy. The patient has the right to know everything about the benefit and risk, the benefit and side effect, the benefit and complication if you are discussing procedure. Okay, this is patient autonomy. So you need to highlight the benefit and or advantages and disadvantages, pros and cons of the genetic. It is not genetic testing, by the way, it's screening. Let us say it's screening. Okay. By the way, if you are dealing with polycystic kidney disease, or if you are dealing with HOOCM, hypertrophic obstructive cardiomyopathy, here imaging is superior to genetic testing. Genetic testing is going to be done only in specific situations. However, usually it is done by ultrasound. Okay. So, Dr. Najib, I am sure that you highlighted the benefit of the screening. You have mentioned to the patient that we will keep you monitored for any complications and we will treat you accordingly and so on. However, I did not feel that you explained the disadvantages of screening. This is very important because the candidate who did this case in the exam, he did the same mistake. He did not mention the disadvantages of the screening. So the examiner commented in his feedback. I'm going to share his feedback during the discussion. Okay. One final comment. Whenever someone tells you, I have no questions for now. For example, by the end of your consultation, you will come to the closure, right? Within the closure, you will ask first if the patient or if the surrogate has questions, concerns, okay, to answer them before moving to your closure. Okay, so have you got any concerns for me? Have you got any questions? No, doctor, nothing comes to mind now. So please, if anything comes to mind later, write it down in a piece of paper and bring this paper with you to the follow-up. We will try to find an answer for you together. We will try to find, or we will try to address your questions. Okay, the examiner will be impressed. This is going to be very nice. Okay.
Okay.
So I feel that your score is going to be something between, let us say, 11 to 13, because you gave inaccurate information within skill F, 50% chance for the kids to get the disease, and you did not highlight the disadvantages of the screening, so you will get you will lose some mark within skill E and skill F. So your score, if the examiner is tough, it's going to be 11. If the examiner is benign, it's going to be up to 13, 14, okay, out of 16. So let us try to approach the scenario. They will give you some time before the station. They will give you a very nice white paper and pencil, actually. Okay, I will prepare for my consultation. I will prepare for the discussion. If you do not prepare, believe me, you will not get the full mark inside the session, no matter how prepared you are. Okay, so from outside, I will enter. I will write in my paper introduction and closure. This is the structure of my consultation, and then it has got a body in between. Introduction and closure in between. I have got the body of the consultation. Introduction is fixed for all. I will introduce myself to the patient. I will confirm his identity. If I am dealing with a patient relative, I will highlight the issue of confidentiality. And then I will ask about the background. How does the patient know about his medical condition before I explain further? After checking his background, I will check his eyes, idea, concern, expectations. Idea, concern, expectations. This is usually done by a single question. And sometimes if the patient finishes his background by raising questions, no need to check his eyes. For example, yes, doctor, my mother, she was admitted in the hospital with infection in her water work. They did a scan and investigation, and they said that she has got polycystic kidney disease. And this condition actually run in the family, and each member of the family might be affected. Doctor, I am really worried that I might have the disease. This is his eyes. This is her eyes. Already she expressed her concern. Already she expressed her worries, and she asked a question. If you repeat, okay, have you got any idea about what could be the diagnosis? Doctor, yes, I just told you that she has got polycystic kidney disease. Have you got any concerns? Yes, doctor, I just told you that I am really worried that I might have the disease. Have you got any expectation from our meeting today? Yes, doctor, I need you to explain to me whether I will have the disease or not. Okay, so it does not make sense. It is irritating for the patient and for the examiner, and it will waste your time. You have got only 10 minutes. You have to use it wisely to cover everything within 10 minutes. Okay, so no need to repeat unnecessary questions. So introduction, and then background, and then eyes. Okay, I will finish after he finishes background and eyes. I'm not going to repeat what he said because I have seen many candidates. He will tell you the story, and then again the candidate, for unknown reason, or For unknown reason, we'll start to repeat the same. Yes, as you mentioned, you were admitted to the hospital with infection in your water work, and we did a scan and investigation. You are wasting your time. You are wasting your time. Okay? Don't repeat his background. Okay, thank you for sharing this with me. I am sorry for what happened to your mother. Full stop. To show some sympathy. And then move forward. Okay? So your mother is diagnosed with a medical condition known as polycystic kidney disease. Let us call it PKD for short. Let us call it PKD for short. If you give the abbreviation, later on during the discussion, no need to repeat every now and then the very long term of the disease. For example, you are discussing HUCM. Whenever you come to the discussion, instead of saying hypertrophic obstructive cardiomyopathy, you can say HUCM if you agree with the patient at the start of the consultation that we can use this abbreviation. So let us call it PKD for short. Okay, so how much do you know about this condition? Did anyone explain to you in details? Do you want me to explain to you further? Maybe someone already explained everything to her. Don't rush and force unnecessary information to your patient. Maybe already she knows, right? Make sense? So ask whether she knows everything and ask whether she wants to know more. Yes, doctor, please. So here from outside in my white paper, I wrote in my preparation paper, introduction and closure, in between there is body, right? So there is body. The body will depend on the category, which case category you are dealing with. Is it explaining disease? Is it explaining new medicine, new procedure? Is it coroner's postmortem? Is it palliative care? Each case category has got its own approach. So the body will depend on the case category. For example, this scenario, what do you think the category here? It is clearly explaining disease, right? Explaining disease. So when you are explaining disease, the approach is fixed. Okay, you will explain triple C and M. Triple C and M. The first C, the clinical picture. The second C, the cause. Sometimes it is not the cause, it is the trigger. For example, I'm explaining myasthenia gravis. All of us know that it is autoimmune disease. However, there is triggers, sometimes triggered by recent infection, recent stress, recent medication, right? So the second C could be the cause or trigger. The third C is the complications. And complications usually before the M, which is the management plan. Why? Because in order for the patient to accept any kind of treatment you are offering, you need to highlight the complication, highlight the problem, then offer the solution. If you do it this way, the patient will accept anyway any treatment you offer. Otherwise, let us assume I did not highlight the complication of atrial fibrillation, which is clot formation. And then I said, we need to give you blood thinning medication. Doctor, I will never take this medicine. I will never take this blood thinning medication. May I know why? Because, doctor, one of my friends, she took this medicine and she developed bleeding in the brain. You will face a lot of questions, concerns, a lot of drama. However, if you tell the patient, I am sorry to tell you that atrial fibrillation might be dangerous. It can result in serious complication. It can result in clot formation within the heart. And then this clot might travel everywhere, like to the brain, resulting in stroke or mini stroke, like to your eyes. And that's why you suffer that episode of blindness. For that, our consultant suggested the need to start blood thinner medication called warfarin. This warfarin will prevent the development of clot. Here, she will accept to take the medicine because she knows that there is serious complication. This is not a game. This is a matter of life and death. So before treatment, always highlight complications. And even sometimes you need to highlight the most extreme or most serious complications before suggesting the treatment plan. And then I will come to the management. Management is fixed. Again, non-pharmacological and pharmacological. Non-pharmacological, again, it is fixed. Team of care and place of care. Team of care and place of care. I will explain the MDT and place of care. For example, you will be on regular follow-up with us here in the clinic. Otherwise, let us assume that the patient needs admission. I will tell him that we will need to keep you in the hospital. I'm not going to tell him you should remain in the hospital. Do not paternalize your patient. You should give the information as advice. We need you, we need you to remain in the hospital. However, it is for the patient whether to accept or to refuse. Okay, do not paternalize your patient. Sometimes it is not only admission and isolation. We will keep you in a room of your own to minimize the risk of transferring the infection to others. So team of care, which is the MDT, and then place of care, whether the patient needs admission or outpatient treatment or isolation. And then there is several non-pharmacological treatment. Like, for example, if it is relevant, you need to advise the patient against smoking, alcohol, driving. Sometimes it is not relevant. Please do not do it as a robot. Sometimes, even if the patient has got fever, for example, for pyelonephritis, please, does it affect your job? Yes, doctor, I will refer you to the occupational therapist. Believe me, some candidates are doing it like this. I remember one of the candidates. He's a very good candidate. However, from the sessions he attended, he understood that whenever the job is affected, refer the patient to occupational therapist. This is very dangerous. You should know exactly when to refer the patient to the occupational therapist, when to refer the patient to the social health department, when to simply offer the patient sick leave. Someone who has got fever due to infection, give him antibiotic. By the end of the treatment, give him sick leave for this duration of hospital stay. That's it. Okay. I don't want to go in irrelevant details. Let us go back to our discussion. So, first C, second C, third C, and then the management plan. Management plan is non-pharmacological as well as pharmacological. Non-pharmacological usually will be team of care and place of care, smoking, alcohol, driving, and so on. Sometimes others, and then you will come to the pharmacological treatment. When I enter inside, I will move step by step according to my paper. Introduction finished, I will put tick over introduction. Background and eyes finished, I will put tick over them. The body finished, I explain the first C, second C, third C, I will be ticking my paper. If you do it this way, you will never forget anything and you will cover the session, and believe me, it will be very easy to get the full mark. Okay, so let us assume I want to explain to this patient. Before explaining the triple C and M, usually we need to draw, especially if you are explaining procedure with the diagnosis. So let us assume I want to draw something to this patient. So let me draw you a very simple drawing. It will help us explain the situation. So let us assume that these are your kidneys and this is your liver. Okay. I will ask the patient, how much do you know about the condition? Did anyone explain to you in details? Do you want to know more about this? Yes, doctor, please. So let me draw you a very simple drawing. It will help us explain the situation. Let us assume that this is your mother's kidney and this is the liver. In people with PKD, there are multiple cysts which are fluid-filled sacs. Fluid-filled sacs. I will draw some lesions in the kidneys and some of them in the liver. Okay. So in people with PKD, there are multiple cysts which are sacs filled with fluid, forming in both kidneys, as well as the liver sometimes, and rarely the pancreas. By the way, pancreas is only affected in 10%. 10%, okay? So this condition run in families from one generation to the next. Here she will start to raise concerns. Okay, so doctor, am I going to have it? Doctor, am I going to have it? I am really sorry to tell you that each one of the offspring has got 50% chance of getting the disease. Each one of the offspring has got 50% chance of getting the disease. So far, what did I explain? By drawing, I explained the anatomy and the pathophysiology. This is the kidney, this is the liver, this is the pancreas, the pathophysiology that you will develop some cyst over these organs. And then I moved to explaining the cause now, the second C. The second C is also covered because already I explained that this condition is autosomal dominant. 50% chance of getting the disease. Okay. So, doctor, what complications are associated with this problem? Is it serious? She might raise concern regarding complication. Is it serious? What are the complications of this condition? So over time, the cyst may get bigger and more of them may start to appear. The cyst may get bigger and more of them may start to appear, resulting in manifestations similar to your model's presentation. For example, sometimes it might cause infection in the waterwork. Sometimes the cyst may rupture, causing tummy pain, belly pain, but not abdominal pain. Abdomen is jargon. So sometimes infection, sometimes it might rupture, resulting in tummy pain. Okay. Sometimes it might cause gravels or stones formation in the kidney. And sometimes the cyst may cause a slow damage to the kidneys, which is in some people. Why did I say in some people? What is the percentage of renal failure requiring dialysis in ADPKD? Any idea? What is the percentage?
After 50 years, 50%, something like that.
Exactly. Excellent. So after 50 years old, the chance is 50%. So sometimes this cyst may cause a slow damage to the kidney requiring dialysis. I mean, artificially filtering the blood from toxins and waste products. Artificially filtering the blood from toxins and waste products. Do not say dialysis without explanation because it will be taken as jargon and you will find this within skill C, communication skills. The candidate mentioned medical jargon and then they will give you borderline or unsatisfactory depending on your performance. So if you mention any jargon, please follow this with explanation. Okay, either you should use non-jargon words or follow each jargon with explanation. So sometimes the cyst might cause kidney failure over time. And this might require either dialysis, which is artificially filtering the blood from toxins and waste product, or transplantation, which is to get a healthy kidney from another person, full stop. So here I finished the complication. You can mention also sometimes it might cause high blood pressure, okay? Rarely it can affect other body parts like the blood vessels in the brain and the heart valves. Okay, so highlight some of the complications. So, doctor, what do you think? Should I have a screening, any screening available for this condition? Do you advise me to go for the screening? Here, I need to give her some idea about the screening. Okay, as we mentioned, in polycystic kidney disease, ultrasound is usually the best way to do the screening, not genetic testing. Okay, only in certain situations you will do the genetic testing in case of ADPKD. Any idea which situation you might need
pregnancy?
to pregnancy maybe? Okay, what else? You mean for the pregnancy itself,
Yes,
not for the patient? Yeah. What else? For example, someone who has family history, ultrasound is negative. However, he is a potential donor. He wants to donate his kidney to someone else. Here, he should undergo genetic testing and test negative before donation. This is the first indication. The second indication, someone who has family history underwent a screening by ultrasound. However, there is cyst, but not consistent with the diagnosis, with the diagnostic criteria. There is, depending on the patient age, you need certain number of cysts to be available for the diagnosis. He has some cysts, however, it is not compatible with the criteria for the diagnosis. Here, you might need genetic testing to confirm the diagnosis. The third indication, someone who has family history, negative ultrasound, however, plan to start a family and wants to know the status. Here, you might need genetic testing. However, in general, the general rule is that ultrasound or imaging is superior to genetic testing. This is also applied in case of HUCM. Okay, so doctor, do you think I should go for the screening? Any screening available? I appreciate your concern. Yes, it's important to undergo screening, which is usually done by a jelly scan. You can say imaging or scan or a jelly scan, okay? So usually done by a jelly scan, as well as other tests, such as checking your blood pressure, requesting blood and urine test to assess your kidney function. Okay. By the way, what is the age? At which age, I mean, you will start screening the patient by ultrasound?
20 years. 20 years.
Exactly, 15 to 20, actually, 15 to 20. Okay. So before 15, are you going to conduct a screening or not?
Yes. No. No indication of screening.
No indication to screen by ultrasound. However, there's other methods to screen for PKD. For example, if even starting from the age of 5, you can screen.
Do genetic. Genetic
not
screening.
genetic. Not genetic.
I mean
before
before 18 years.
Yes, I know. However, even before 15 years of age, usually genetic testing is not the favorable method to screen the patient, because you might test positive and yet you do not develop the disease. You might test negative and yet you develop the disease. It is not indicated usually. Okay, ultrasound is not indicated because the patient usually will not develop enough cyst, or he might not develop cyst before the age of 15 to 20. However, you will screen pediatrics usually by checking the blood pressure, checking urine and kidney function. Okay, blood pressure, urine analysis, and kidney function. This is the methods you can use for pediatric patients. Okay, so I appreciate your concern. Yes, it's important to undergo screening, which is usually done by a jelly scan, by a scan, by imaging, okay, as well as other tests, such as checking your blood pressure, requesting blood and urine tests to assess your kidney function. It's important. It will tell us if you have the disease or not. And here I need to tell her why. What is the benefit? What is the benefit if I do the screening or not? So it will tell us if you have the disease or not. Okay. Once the scan is done, we will discuss the issue with you further. Hopefully, the scan will be normal and no treatment will be required in your case. I have to highlight this. I have to give her some hope. It is 50-50, right? Do not assume that she has the disease. Do not assume that she has the disease. I hope, this is not false hope, I hope that the scan will come back normal. Okay, and no treatment is required in your case. What about my siblings, doctor? Should they get screening? So here, there is important question before giving the advice. What questions you will ask?
The age of the siblings.
Excellent. You need to ask about the age. Okay, so if you say, for example, 20, 18, anything above 15, you can request a screen by ultrasound. Okay, so are my kids going to have it? As we mentioned, it is not 50% in her kids because we do not know her status. If she is known to have polycystic kidney disease, the diagnosis is confirmed, then they have 50% chance. Otherwise, because we do not know her status, it is 25%. How to respond to her concern? I appreciate your concern. We need to confirm your status first. If it was found that you have the disease, then they will have 50% chance of getting the disease. Otherwise, if you do not have it, most likely they will not develop the disease. Okay. So, just a second. I mentioned so far. I mentioned that she needs screening. This is mainly the management plan. By the way, it is the consultation in the exam will be centered around her daughter, not the patient herself. not the patient herself. It will be centered around her daughter. In your management plan, you will be focusing more on her daughter, the surrogate, not the patient. Okay. So when I start explaining the management plan, we will need I will need to highlight a plan for work, because in the exam, by the way, the examiner commented on the surrogate performance that he did not agree a plan for work. Make sure whenever you are dealing with communication, you are explaining a disease, you need to highlight in a clear, straightforward way what should be the plan for work. It has to be clear. You have to agree a plan of management with the patient. So what we need to do now is to arrange the screening for you. We need to arrange for the screening. Once we have the result of the scan and other tests, we will arrange another meeting to discuss the issue with you further. I hope the test result will come back negative. But I would like to assure you, in case it was positive, we will be by your side. We will not leave you alone. We will provide you with the best treatment and care available. What did I do here? What did I do here? By the way, the examiner, one of the examiner's comment also was that the candidate lacked sympathy. You have to sympathize and empathize with your patient. Okay. I hope that the test will be negative. However, if the test came positive, I assure you, we will not leave you alone. We will provide you with the best treatment and care available. Okay. And then I will explain which treatment and which care she will receive. What is the benefit of this screening? So we will keep you on a regular follow-up here with us in the clinic. Team of care and place of care finished. We are in nephrology clinic, right? So the MDT will include the kidney doctor. We will involve the kidney doctor to monitor you for the development of any complications, and we will provide treatment accordingly. Full stop. Okay, so I will highlight that the benefit of treatment is that we will keep you monitored for any complications, monitored by MDT for any complications, and we will treat those complications accordingly. Here, the benefit is done. The advantages of the screening are explained. Immediately, I will move to the disadvantages. Otherwise, you will find it in your feedback, believe me. Okay, I will share the candidate feedback in a minute. So, however, before going for the screening, I want you to know that the screening has got some disadvantages. The screening has got some disadvantages. So if I ask you what disadvantages I can explain to her, any idea?
The false positive result.
Excellent.
And if the patient result came back positive.
Actually, it is not false positive, it is false negative. Why? Because I'm not explaining genetic testing here, I'm explaining ultrasound. What do you mean by false positive? If you see the cyst, she develops the disease, right? It is not false positive. However, I can explain false negative. This point is very important. Did you get it? False negative, not false positive. Here, positive ultrasound means diagnosis, not like genetic testing. If you have the bad gene, you might or might not develop the disease in the future. However, this is a screening by ultrasound. If you have the cyst, then you have the diagnosis. Did you get this point? Shall I repeat?
Yeah, I get it. Thank you.
Yeah. Okay, what else apart from false negative result? Here, there is a chance that even if the ultrasound is negative, at some point in the future, she might develop the disease, especially over 30 or over 40 for type 2. So what other disadvantages I can explain? Any idea? It might affect her insurance policies, right? If you test positive for polycystic kidney disease, you might have difficulty obtain life insurance. Life insurance. If you already have the insurance, previous or existing insurance policies will be honored. However, new insurance, if you want to make a new insurance, it might be affected by the fact that you have a chronic condition, by the fact that you have polycystic kidney disease. Is it clear? Clear?
Yes.
Okay.
So after explaining the benefit, which is follow-up, and then we will treat complications accordingly, I will move to the disadvantages. Okay, so before going for the screening, I want you to be aware that the screening has got some disadvantages. Importantly, being diagnosed with polycystic kidney disease could potentially affect your ability to obtain life insurance. Previous insurance policies will be honored. However, if you plan to do a new insurance policy, it might be affected. Then the second disadvantage is screening might be less reliable when you are younger. I will not explain in more details like type 1 gene, type 2 gene, if you are less than 30, less than 40, no need for this. Screening might be less reliable when you are younger. I mean, you might test negative and then develop the disease later. You might test negative now, but develop the disease later. Ultrasound might be normal now. However, later on, you might develop the disease. For that, you might need to do the screening annually. This is a disadvantage. It's not going to be done once, maybe every 6 months, maybe every 2 months, in average annually. Okay. So here I explained the advantages and disadvantages. I agreed a plan forward with the patient and with sympathy. Most importantly, with sympathy. Believe me, if you do it this way, you will get the full mark. However, what happened in the exam is that the candidate actually, the candidate did many mistakes in this scenario. Okay, one of them, she said to the patient, despite this candidate, by the way, she was very well prepared. She was very confident, but I don't know, she was unlucky. Sometimes it will depend on guidance from Allah subhanahu wa ta'ala. موضوع توفيق. So she said to the daughter, your mother will need dialysis. And actually, in her scenario, it was mentioned that this is a stage 4 chronic kidney disease. Usually, dialysis is for stage 5, right? So the surrogate said, why didn't you tell me this before? And then she had to address her concern. Okay, she provided inaccurate information, and also she wasted her time explaining why the surrogate was not informed about this information. So take care. Don't mention information which is not in your scenario. This is stage 4. Usually, they should not start dialysis unless in certain indications, for example, develop urinary pericarditis or acidosis or whatever. Okay, but usually stage 5. Don't mention that she will need dialysis. She might in the future, I know, she's in stage 4. She might go to stage 5 and then require dialysis at some point. But as for now, you don't need to mention that we will do dialysis for her. Then another mistake the candidate did, she mentioned, since you are 24, you can do the screening, but it would affect your insurance plan. It will affect your insurance plan. Up to here, this is fine. However, the surrogate raised a concern. How will the screening affect my insurance plan? She was not sure about how to answer this question. So she said, I will involve the insurance team and the managers, and then you can get more details regarding that. It does not make sense, right? How are you going to involve the insurance team? Okay, you can simply address her concern by mentioning that previous insurance plan or previous insurance agreements will be honored. However, if you plan to do new insurance policy or to get life insurance, it might be affected by the fact that your screening is positive. Full stop. Okay. Then also, she did not mention the pros and cons of the screening. For example, she did not mention that in case you test positive, we will keep you on regular follow-up and we will treat complications accordingly. So just a minute, I will share this part. So it's very important to to discuss the pros and cons. As you can see within skill F, which is managing patient concern, she was given unsatisfactory. She was given 0 out of 4 in skill F. And the examiner commented here that she could not clearly explain pros and cons of screening test. Okay, and check the second comment, apparently lacked empathy. They commented within skill F, within skill C, both examiners, one of them mentioned blank communication. So take care. This is why I kept telling you, you have to show sympathy. Okay, so you need to explain the pros and cons of the test. Another mistake done by the same candidate, she gave a lot of warnings to the patient. For example, sometimes the cyst might rupture or you might develop a stone. So please, if you develop any abdominal pain, come to the hospital for assessment and treatment. Sometimes it might cause dilatation or ballooning in the blood vessels in the brain. So please, if you develop any headache, come to the hospital because this might be bleeding in the brain. Please, if you experience any heart racing, this might be mitral valve prolapse. Please, if you develop any symptoms, you need to come to the hospital. Avoid participating in contact sport. By the way, Dr. Najib, you did the same mistake. You advised the patient to avoid contact sport, and the patient doesn't know. We do not know whether she has ADPKD or not. Don't rush in providing such information. We need to know the status of the patient first. Does she actually have ADPKD or not? And then you can provide such warnings. So the examiner comment was, she was inclined to the pessimistic side of the issue. She was pessimistic. She was not optimistic. She did not tell the patient that hopefully the test will be negative. Anyway, it is 50-50 chance of getting the disease. Hopefully the test will come back negative and no need for, there will be no need for treatment, for example. She gave her full warnings. Despite that, we don't know her status. I will share the exam feedback. This is very important because, by the way, there are 2 scenarios appeared in the same diet. One of them is this scenario. We'll be discussing the issue with a surrogate for which we don't know the status. We don't know whether she has ADPKD or not. Another different scenario, you will be discussing the situation with a patient of ADPKD. Okay, her father already has got ADPKD and he is on dialysis. For the surrogate himself, she developed abdominal pain and she underwent assessment and she had masses in the flank. So she was found to have ADPKD herself. That's why you need to explain the plan of management in details, and you need to give her warning that she should avoid contact sport to avoid rupture of the cyst, right? However, the candidate, when she went to the exam, she was occupied by this case. That's why she gave warning and she was very pessimistic in her discussion with the patient. If you don't know the status of the patient, no need to tell her avoid contact sport and report to hospital in case of headache. No need for this. Okay, so as you can see, again within skill E, which is the management plan, the clinical judgment, the examiner commented that more inclination toward pessimistic side of the issue. Okay, and check the second comment, did not offer any positive plan or way forward. So this is very important. Okay, you have to agree a plan forward with the patient, which is basically to tell her that if in the unfortunate event you tested positive, you were diagnosed with ADPKD, we will keep you monitored in our clinic for any complications, and then we will treat you accordingly. Clear? Is it clear? And then this comment is for you, Dr. Najib is here, or?
Yep. Yes. Hello.
I will share this part of the feedback. So when you go to the exam, in case you face the same scenario, you will never do the same mistake again. Check what did the examiner comment here. This is a skill C, which is communication. Okay. Check the examiner's comment. It is very bad handwriting. However, I can read for you. Okay. So she warned the daughter that she should not be in contact sport. She should not participate in contact sport without knowing that she has polycystic kidney disease. This is the same mistake you have done, right? You told the daughter, please avoid contact sport. You need to know her status first. Clear?
Yes. Yes.
Okay, so take care. There is two different scenarios. One of them, you will be speaking to a patient. She has got family history. Her father is on dialysis, and herself, she is diagnosed. Here, you need to mention everything. However, this scenario is different. You are speaking to a surrogate, 50-50 chance. She might not have the disease, so do not incline toward the pessimistic side of the story. Try to assure her, maybe the test will be negative. If the test is positive, we will take care of you, sympathize with her, agree a plan forward. We will keep you monitored. If you develop any complications, we will treat you accordingly. That's it. Is it clear? Any question regarding these scenarios?
Clear.
Okay, brilliant. So, thank you for attending the session of today. See you next session, inshallah. And good.
Thank you.
I will share the recording, inshallah, in the group later. Okay. Thank you. Goodbye.
Thank you very much.
Thank you, Doctor.